Good morning, Virginia. This is Virginia This Morning.
And welcome back to Virginia This Morning. You may never have heard of this condition if you don't have it. Lumbar spinal stenosis is a degenerative condition caused by the overgrowth of bone and tissue that press on spinal nerves. Here to tell us about the symptoms and treatment options is local orthopedic surgeon Dr. Jed Van. Good morning, doctor.
Good morning.
We were just chatting briefly during the commercial break because I really don't know anything about this. You said this is actually a common condition.
Spinal stenosis is a very common condition. It's a natural process that happens in terms of the lower back. As we get older, the disc or the cushions in your back start to degenerate, and they'll get calcify and bulge. That will cause some overgrowth of some of the joints and bone in the back, and you get a narrowing of where the nerves come out and go into your legs. So normally we have about a quarter-size space for our nerves that go into our legs. Spinal stenosis, it can narrow down to like the size of a dime, if not smaller. And that makes it so you can't stand very long, can't walk very long without your legs starting to ache or go numb.
And the amazing thing about this, you were saying, is as we get older, as we age, more people will get this. It's more possible that we'll get this than not get this.
Everybody will get it if they get old enough. It's just a natural aging process, but some people are more symptomatic than others. So when the symptoms get bad is when we usually have to come and intervene.
So what are the symptoms of this?
Again, spinal stenosis very classically it's pain when you when you stand for long periods of time, when you're trying to walk, going up and down stairs. You can walk for certain distances and then have to sit down for a little bit to get the pain to go away. We call that claudication.
So what are the treatments for this?
We typically start with the conservative management. You'll start with anti-inflammatory medications, physical therapy, core strengthening. Sometimes we have to do things like injections of cortisone epidurals, and sometimes if it's severe enough we'll do surgical procedures to relieve that pressure. And
you do a relatively new surgical procedure right now that you've got a little piece of equipment for.
So the standard decompression that we do, where we have to go and take bone spurs out for spinal stenosis, it typically is usually been through a wide incision. You take a lot of muscle, you take a lot of normal bony tissue in order to address the problem. With this new iO-Flex shaver, we can now do it through a little smaller incision, about a third of the size of what we normally do, and then patients can go home the same day instead of staying in the hospital 2 or 3 days.
And we've got some video of a surgery. How long of a surgery does this take?
Typically, if it's a one-level surgery or kind of a focal level of stenosis, we can do a procedure in about 45 minutes.
And you're talking about going home the next day or the same day. That's amazing.
Yeah, it's definitely, with the patients that we've been doing over the last year and a half, we've been able to save them from having, again, extended stays in the hospital. We've been able to save them from having rods and screws put in their back. So it has been very beneficial.
Okay, we talked about the fact that this is something that all of us will get if we get old enough. Is there something we can do to prevent this?
Absolutely. With any back condition or anything, if you stay the more fit and active, we see a lot of people with early stages of spinal stenosis, and we encourage them to do core strengthening and staying active, exercising 3 days a week at minimum, doing something, even if it's not back related, can really minimize the amount of lower back pain or sciatica that you can get.
So like weight-bearing exercises, walking, and just getting out and staying active?
Walking, running, anything 30 minutes or more, 3 times a week will do a ton.
So what symptoms should we be looking for if this gets to be a problem that needs to be looked at by a doctor?
If you have back pain that lasts more than the typical 3 or 4 days and it gets better, or if you develop any kind of bowel or bladder issues, any numbness and tingling that goes all the way down to your toes, or weakness, or prolonged weakness, then you need to probably see somebody sooner versus later.
All right. Well, Dr. Jed Van, thank you so much for joining us today.
Thank you.
You're very welcome.